50. NCLEX practice questions with rationales. Mixed nursing review for RN and PN students. Question number 1. A client taking antihypertensive medication reports feeling dizzy when getting out of bed in the morning. Which instruction should the nurse give? Letter A. Stand up quickly to improve circulation. B. Sit on the side or at the edge of the bed before standing. C. Skip your medication if dizziness occurs. Or D. Increase your salt intake in the morning. The correct answer is going to be letter B. Sit on the edge of the bed before standing. Rational. Antihypertensive medications can cause orthostatic hypotension, which is a drop in blood pressure when changing positions. Sitting before standing helps the body adjust and reduces the risk of dizziness and falls. Question number 2. A post-operative client is prescribed anti-embolism stockings. Which statement shows the client understands the teaching? A. I should apply the stockings before getting out of bed. B. I should roll the stockings down if they feel tight. C. I only need to wear them while I'm sleeping. D. I should remove them whenever my legs feel cold. The correct answer is letter A. I should apply the stockings before getting out of bed. Rationale. Anti-embolism stockings help prevent venous pooling and blood clot formation. They should be applied before the client gets out of bed when leg swelling is minimal. Question number 3. A client with heart failure is taking digoxin and pyrosamide. Which laboratory value is most important for a nurse to monitor? A. Sodium. B. Potassium. C. Hemoglobin. Or D. Calcium. Okay, so the correct answer is letter B, potassium, right? The rationale is this. Pyrosamide or Lasix can cause potassium loss. Low potassium or hypokalemia increases the risk of digoxin toxicity and dangerous heart rhythm problems. Monitoring potassium is a priority for client safety. Let's go to question number 4. A client with angina is prescribed digoxin or nitroglycerin tablets. Which instructions should the nurse include? A. Keep the medication in its original dark container. B. Take the medication with a full glass of water. C. Stop taking the medication if you develop a headache. Or D. Store the medication in a weekly pill organizer. The correct answer is letter A. Keep the medication in its original dark container. So this is the rationale. Nitroglycerin is sensitive to light, heat, and moisture. Keeping it in the original dark container helps maintain its effectiveness. Question number 5. A nurse is caring for a client with chronic venous insufficiency. Which finding would the nurse expect? A. Pale, cool skin with absent pulses. B. Brown discoloration around the ankles. C. Sudden sharp chest pain. Or D. Weakness on one side of the body. Okay, y'all, the correct answer is letter B, brown discoloration around the ankles. This is the rationale. Chronic venous insufficiency causes poor return of blood from the legs to the heart. This can lead to swelling, skin changes, brown discoloration, and venous ulcers, especially around the ankles. Next question. A nurse is caring for a client who is receiving warfarin or Coumadin, that's the brand name. Which laboratory test is most important for monitoring the therapeutic effect of this medication? Letter A, hemoglobin. Letter B, platelet count. Letter C, INR. Or letter D, potassium level. The correct answer is, of course, INR. Letter C. Warfarin is an anticoagulant that helps prevent blood clots. The INR is used to monitor whether the dose is therapeutic. If the INR is too low, clotting risk increases. If it's too high, bleeding risk increases. Let's look at the next question. A client taking an ACE inhibitor for hypertension reports a persistent dry cough. Which action should the nurse take first? A. Ask how long the cough has been occurring. B. Encourage the client to drink more fluids. C. Tell the client to stop taking the medication. Or letter D. Teach the client to take the medication with food. Okay, so the correct answer is letter A. Asked how long the cough has been occurring. The rationale. A persistent dry cough is a common side effect of ACE inhibitors. Example would be lisinopril. The nurse should first assess the symptoms further, including onset, severity, and whether it is interfering with daily activities. The client should not stop the medication without direction from the healthcare team. Next question. A nurse is teaching a client with peripheral arterial disease. Which statement by the client shows correct understanding? A. I should apply a heating pad to my feet when they feel cold. B. I should inspect my feet every day for cuts or sores. C. I should walk barefoot at home to improve circulation. And letter D. I should cross my legs when sitting to reduce swelling. Okay, the correct answer is letter B. I should inspect my feet every day for cuts or sores. Rationale. Peripheral arterial disease decreases blood flow to the legs and feet, which delays wound healing and increases the risk for ulcers or infection. Daily foot inspection helps detect problems early on. Next question. A client with left-sided heart failure is being assessed by the nurse. Which finding is most expected? A. Crackles in the lungs. B. Enlarged liver. C. Swelling in the abdomen. Or D. Distended neck veins. Okay, the correct answer is letter A, crackles in the lungs. The rationale. Left-sided heart failure causes blood to back up into the lungs. This can lead to pulmonary congestion, which may be heard as crackles during lung auscultation. Question number 10. A nurse is teaching a client with hyperlipidemia about dietary changes. Which food choice shows the client understands the teaching? A. Fried chicken. B. Whole milk. C. Baked fish. Or D. Sausage links. Y'all, the correct answer is letter C, rational. Baked fish is lower in saturated fat than fried foods, whole milk, or sausage. Choosing lean protein and avoiding high fat foods can help reduce cholesterol levels and support cardiovascular health. Our next question. A client is receiving heparin by continuous IV infusion. Which laboratory test should the nurse monitor to evaluate the medication's therapeutic effect? Letter A, INR. Letter B, APTT. Letter C, hemoglobin A1C. Or letter D, serum calcium. Okay, the correct answer is of course letter B, which is APTT. This is the rationale. Heparin is monitored using the APTT. This test helps determine whether the medication is preventing clot formation without placing the client at risk for bleeding. Okay, y'all, next question. A nurse is assessing a client with suspected myocardial infarction. Which finding is most concerning? Letter A, chest pain unrelieved by nitroglycerin. Letter B, mild headache after medication. Letter C, warm skin after ambulation. Or letter D, heartburn after eating. The correct answer is of course letter A, chest pain unrelieved by nitroglycerin. Rationale. Chest pain that does not improve with nitroglycerin may indicate myocardial infarction. This requires rapid assessment and intervention because heart muscle may be deprived of oxygen. Our next question. A client with hypertension asks why they should reduce sodium intake. Which response by the nurse is best? Letter A, sodium can cause fluid retention, which may increase blood pressure. Letter B, sodium prevents your heart from beating too quickly. Letter C, sodium lowers cholesterol levels in the bloodstream. Or letter D, sodium improves blood flow to the kidneys. The correct answer is letter A. Sodium can cause fluid retention, which may increase the blood pressure. Rationale. Excess sodium can cause the body to retain water. Increased fluid volume can raise blood pressure and increase the workload of the heart. Next question. A client is taking digoxin. Which finding would be most important for the nurse to assess before administering the medication? Letter A, respiratory rate. Letter B, apical pulse. Letter C, bowel sounds. Or letter D, skin turgor. The correct answer is, of course, letter B, apical pulse. Digoxin slows and strengthens heart contractions. The nurse should assess the apical pulse for at least 1 minute before giving it because a low heart rate may indicate the medication should be held according to policy or prescribed parameters. Let's go to the next question. A client with peripheral arterial disease reports leg pain while walking that improves with rest. How should the nurse interpret this finding? A, venous stasis. B, intermittent claudication, C. Pulmonary embolism, or D. Orthostatic hypotension? Okay, the correct answer, y'all, is letter B, intermittent claudication. Rationale. Intermittent claudication is leg pain caused by decreased arterial blood flow during activity. The pain usually improves with rest because the muscle needs less oxygen. Question 16. A nurse is teaching a client who is prescribed simvastatin, which is a statin. Which instruction should the nurse include? A. Report unexplained muscle pain or weakness. B. Take the medication only when chest pain occurs. Letter C. Increase intake of high fat foods. Or letter D. Stop the medication once the cholesterol improves. The correct answer is letter A. Report unexplained muscle pain or weakness. Rationale. Statins can rarely cause muscle injury. Unexplained muscle pain, tenderness, or weakness should be reported immediately because it may indicate a very serious side effect. Next question. A client has left-sided heart failure. Which assessment finding would the nurse expect? A. Crackles in the lungs. B. Increased appetite. C. Dry mucous membranes. Or D. Decreased respiratory rate. Okay, so the correct answer, y'all, is letter A, crackles in the lungs. The rational left-sided heart failure causes blood to back up into the pulmonary circulation. Fluid can collect in the lungs, causing crackles, shortness of breath, and cough. Next question. A nurse is caring for a client with chronic venous insufficiency. Which intervention is most appropriate? Letter A. Elevate the legs when sitting. Letter B. Keep the legs below heart level. Letter C. Apply heating pads to the feet. Or letter D. Encourage crossing the legs while resting. Okay, so the correct answer is, of course, letter A, which is elevate the legs when sitting. Here's the rationale. Elevating the legs promotes venous return and helps reduce swelling. Keeping the legs dependent or crossing them can worsen venous filling. Next, a client is prescribed clopidogrel. Which symptom should the nurse teach the client to report? A. Nosebleeds. B. Increased appetite. C. Dry skin. Or D. Mild thirst. Okay, so the correct answer is letter A, nosebleeds. So clopidogrel decreases platelet aggregation. So it's a medication that we are classifying as an antiplatelet. This increases bleeding risk. Nosebleeds, bleeding gums, unusual bruising, or blocked stool should be reported immediately. Next. A nurse is teaching a client with coronary artery disease about diet. Which food choices indicates the client understands the teaching? A. Bacon and egg. B. Fried pork chops. C. Grilled chicken breast. Or D. Whole milk and sausage. Okay, y'all, the correct answer is letter C, grilled chicken breast. Rational, grilled chicken breast is a lean protein choice and is lower in saturated fat than bacon, of course, sausage, whole milk, or fried meats. Lowering saturated fat intake helps support cardiovascular health. Okay, so next question. A nurse is caring for a client with suspected fluid volume overload. Which assessment finding best supports this concern? Letter A, dry mucous membranes and poor skin turgor. Letter B, flat neck veins and decreased urine output. Letter C, crackles in the lungs and bounding peripheral pulses. Or letter D, increased hematocrit and sudden weight loss. Okay, the correct answer is letter C, crackles in the lungs and bounding peripheral pulses. The rational fluid overload or volume overload occurs when there is too much circulating fluid. Crackles can develop from fluid backing up into the lungs, and bounding pulses may occur because of increased vascular volume. Our next question. A client with chronic obstructive pulmonary disease is receiving oxygen therapy. Which oxygen delivery method is most appropriate for providing a precise low concentration of oxygen? Letter A, simple face mask. Letter B, nasal cannula at 6 liters per minute. Letter C, non-rebreather mask. Or letter D, Venturi mask. Okay, so the correct answer is letter D, Venturi mask. The word precise is the key word in there. The rationale. A Venturi mask delivers a controlled and precise, there you go, oxygen concentration. This is especially useful for clients with COPD because too much oxygen may worsen carbon dioxide retention in some clients. 23. Question number 23. A nurse is assessing a client with acute kidney injury. Which finding would the nurse expect during the oliguric phase? A, increased urine output and hypokalemia. B, decreased urine output and hyperkalemia. Letter C, weight loss and low blood pressure. Or letter D, metabolic alkalosis and increased appetite. Okay, y'all, the answer is letter B. The word oliguria is the key word there. Decrease urine output and hyperkalemia. This is the rationale. During the oliguric phase of acute kidney injury, urine output decreases. Because the kidneys cannot remove potassium effectively, hyperkalemia can occur. This is dangerous because elevated potassium can cause life-threatening dysrhythmias. Let's look at the next question. A client with diabetes mellitus is confused, diaphoretic, and shaky. The blood glucose level is 48 milligrams per deciliter. Which action should the nurse take first? A, give 15 grams of a fast-acting carbohydrate. Letter B, administer scheduled long-acting insulin. Letter C, encourage the client to walk to increase circulation. Or letter D, hold all food until the next scheduled meal. Okay, the correct answer is letter A. Give 15 grams of a fast-acting carbohydrate. This is the rationale, y'all. The client is experiencing hypoglycemia. If the client is conscious and able to swallow, the priority action is to give a fast-acting carbohydrate such as glucose tablets, juice, or regular soda. Blood glucose should then be rechecked. Question number 25. A client with increased intracranial pressure is being cared for on the unit. Which nursing action is most appropriate? A. Keep the client flat in bed. B. Cluster all care into long sessions. C. Encourage frequent coughing. Or D. Maintaining the head of the bed at 30 degrees. Okay, correct answer is D. Maintaining the head of the bed at about 90 degrees. Rational. Elevating the head of the bed promotes venous drainage from the brain and can help reduce intracranial pressure. Lying flat, frequent coughing, and long clustered care sessions can increase the pressure inside the skull. Next question. A 2-year-old child is admitted with dehydration from vomiting and diarrhea. Which assessment finding is most concerning? A. Crying when the parent leaves the room. B. Refusing solid foods. C. A heart rate of 168 per minute with cool extremities. Or letter D. Weight loss of 2% from baseline. Okay, so the correct answer is letter C, a heart rate of 168 beats per minute with cool extremities. So this is the rationale. A very fast heart rate with cool extremities may indicate poor perfusion and worsening dehydration. In young children, signs of circulation problems can appear quickly and require immediate nursing attention. Refusing solid foods and crying with separation can be expected in a sick toddler. A 2% weight loss suggests mild dehydration, but poor perfusion is most concerning. Next question. A nurse is caring for a client receiving magnesium sulfate for preeclampsia. Which finding indicates possible magnesium toxicity? A. Respiratory rate of 10 per minute. B. Blood pressure of 146 over 92. C. A urine output of 40 ml per hour. Or letter D. Patellar reflexes 2 plus. Okay, the correct answer is letter A, respiratory rate of 10 per minute. This is the rationale. Magnesium sulfate can depress the central nervous system. A respiratory rate of 10 per minute is concerning for toxicity. The nurse should monitor deep tendon reflexes as well, level consciousness, and urine output because magnesium is cleared by the kidneys. Our next question. A client with major depression says, "My family would be better off without me." Which response by the nurse is most concerning? Letter A. You should not say things like that because your family loves you. Letter B. Try focusing on positive thoughts instead. Letter C. Many people feel sad sometimes, but it usually passes. Or letter D. Are you thinking about harming yourself? Okay, letter D is the correct answer. Are you thinking about harming yourself? So this is the rationale. A client's statement suggests possible suicidal thinking. The nurse should ask directly about self-harm. Direct questioning does not put the idea into the client's mind. It actually helps assess safety and risks. Next question. A client is prescribed prednisone for an inflammatory condition. Which instruction should the nurse include? A. Stop the medication as soon as symptoms improve. B. Take the medication on an empty stomach. Letter C. Avoid taking this medication with any food. Or letter D. Do not stop this medication suddenly. Okay, the correct answer is letter D. Do not stop this medication suddenly. This is the rationale. So remember, prednisone is a steroid, so it's a corticosteroid. Stopping it suddenly can cause adrenal insufficiency, especially after long term use. The dose may need to be tapered as prescribed. Taking it with food is often recommended to reduce stomach irritation. Question number 30. The nurse is caring for poor clients. Which task is appropriate to delegate to experienced unlicensed assistive personnel? A. Ambulate a stable post-operative client for the first time after surgery. B. Teach a client how to use an incentive spirometry. C. Measure and record urine output from an indwelling catheter. Or letter D. Assess client's pain after IV morphine administration. Okay, the correct answer is letter C. Measure and record urine output from an indwelling catheter. This is the rationale. Measuring and recording urine output is a routine task that can be delegated to a trained, unlicensed assistive personnel. Teaching, assessment, evaluation of pain medication effectiveness, and first-time post-operative ambulation require nursing judgment and should be performed by the nurse. Our next question. The nurse is caring for 4 clients. Which client should the nurse place on an airborne precautions? Letter A. A client with a draining cellulitis of the leg. B. A client with active TB. Letter C. A client with bacterial pneumonia. Or letter C. A client with urinary tract infection. Okay, so the correct answer is letter B, a client with active TB. So this is the rationale. Active TB require airborne precautions because it spreads through tiny particles that can remain suspended in the air. The client should be placed in a negative pressure room. That's another key answer there. And staff should wear an N95 respirator or a mask. Next question. A nurse is assessing a newborn 1 hour after birth. Which finding requires most immediate action? Letters A. Acrocyanosis of the hands and feet. Letter B. Respiratory rate of 58 per minute. Letter C. Nasal flaring and grunting. Or letter D. Heart rate of 142 beats per minute. And this is a newborn patient. Okay, the correct answer is letter C, nasal flaring and grunting, and this is the rationale. Nasal flaring and grunting are signs of respiratory distress in a newborn. Acrocyanosis can be abnormal shortly after birth, and a respiratory rate of 58 per minute and a heart rate of 142 per minute are within expected newborn ranges. Our next question. A client with schizophrenia says the cameras in the ceiling are watching me. Which response by the nurse is most therapeutic? Letter A. There are no cameras in the ceiling. Letter B. Why do you believe someone is watching you? Letter C. That sounds frightening. I do not see cameras, but I will stay with you. Letter C. You need to stop thinking that way so you can feel better. Okay, the correct answer is letter C. That sounds frightening. I do not see cameras, but I can stay with you. Rational. The nurse should acknowledge uh, the client's feelings without confirming the delusion. This response provides support, presents reality in a calm way, and promotes safety without arguing. Our next question. A child with asthma is using accessory muscles and has wheezing that suddenly becomes very faint. Which interpretation is most accurate? Letter A. The child's airway obstruction may be worsening. Letter B. The medication has relieved the bronchospasms. Letter C. The child is ready for discharge teaching. Or letter D. The child is developing a mild allergic rash. Okay, correct answer is letter A. The child's airway obstruction may be worsening, and this is the rationale. In asthma, wheezing that becomes very faint or disappears while distress continues can mean poor air movement. It's actually not improvement. This is a serious finding because the child may be tiring or developing severe airway obstruction. Our question number 35. A client with type 1 diabetes is prescribed insulin glargine. Which statement by the client indicates correct understanding? Letter A. I will use this insulin to treat sudden low blood sugar. Letter B. I should mix this insulin with regular insulin in the same syringe. Letter C. This insulin provides long acting background control. Or letter D. I should take this insulin only when my blood sugar is high. Okay, so the correct answer is letter C. This insulin provides long-acting background control. Rationale. Insulin glargine is a long-acting basal insulin. It provides steady background glucose control and is not used for rapid correction of high blood glucose or treatment of hypoglycemia. It should not be mixed with other insulins in the same syringe. Next, a nurse is preparing to administer medications to a client who has a new allergy bracelet. Which action should the nurse take first? A. Compare the allergy bracelet with the medication administration record. B. Ask another nurse to remove the allergy bracelet. C. Give the medication if it was previously prescribed. Or letter D. Document the allergy after giving the medication. Okay, y'all, the correct answer is letter A. Compare the allergy bracelet with the medication administration record, and this is the rationale. The nurse should verify the allergy before giving any medication. Comparing the allergy bracelet with the medication record helps prevent an allergic reaction or a medication error. 37, question 37. A postpartum client reports heavy vaginal bleed. The nurse assesses a baggy uterus that is displaced to the right. Which action should the nurse take place? A. Encourage the client to increase oral fluids. B. Assist the client to empty the bladder. C. Place the client in a high Fowler's position. Or letter D. Apply a warm compress to the abdomen. Okay, correct answer is letter B. Assist the client to empty the bladder. Rational, a full bladder can push the uterus to one side and prevent it from contracting firmly, increasing postpartum bleeding. Emptying the bladder helps the uterus return to midline and contract effectively. Our next question. A 6-month-old infant with bronchiolitis has nasal flaring, moderate retractions, and poor feeding. Which intervention is the priority? A. Offer small frequent feedings. B. Teach the parents about hand hygiene. Letter C. Suction the nares gently as needed. Or letter D, place the infant flat after feeding. Okay, so the correct answer is letter C, suction the nares gently as needed. Here's the rationale. Infants are primarily nose breathers. Nasal congestion can worsen breathing effort and interfere with feeding. Gently suctioning helps maintain airway patency and decreases respiratory distress. Our next question. A client with panic disorder begins trembling, reports chest tightness, and says, I feel like I'm dying. Which nursing response is most appropriate? A. You are not dying, so try to calm down. Letter B. Let's discuss what triggered this feeling. Letter C. I will stay with you and help you slow your breathing. Letter D. You should ignore the symptoms until they pass. Okay, so the correct answer is letter C. I will stay with you and help you slow your breathing. Rationale. During a panic attack, the nurse should remain with the client. Use simple directions and reduce stimulation. Teaching or exploring triggers can happen later when anxiety decreases. Our next question. A client taking spironolactone asks which food should be limited. Which response is best? A. Bananas. B. White rice. C. Applesauce. Or D. White bread. Okay, the correct answer is A. Bananas. So, spironolactone is a potassium sparing diuretic. Bananas are high in potassium, so eating large amount can increase the risk of hyperkalemia. Question number 41. A client with chronic kidney disease has a potassium of 6.3. Which assessment finding is most concerning? A. Dry skin. B. Muscle cramps. C. Peak T waves on ECG. Or D. Mild uncle edema. Yes, the correct answer is letter C, peak T waves on ECG. So this is a very high potassium. 6.3 is dangerously high. Peak T waves indicate cardiac effects of hyperkalemia and may progress to life-threatening dysrhythmias. Next question. An RN is working with an LPN, LVN, and unlicensed assisted personnel. Which task is most appropriate for the RN to assign to the LPN or LBN? A. Develop a teaching plan for a newly diagnosed diabetic client. B. Evaluate a client's response to IV pain. Letter C. Administer an oral antibiotic to a stable client. Or letter D. Interpret the client's new abnormal ECG rhythms. Okay, so the correct answer is C. Administer an oral antibiotic to a stable client. And this is the rationale. An LBN or an LPN can administer routine medications to stable clients depending on facility policy and scope of practice. Initial teaching, evaluation, and interpretation require an RN judgment. Next question. A patient with cirrhosis is admitted with confusion, asterexis, and a fruity musty breath odor. Which prescription should the nurse anticipate? Letter A. Lactulose. Letter B. Loperamide. Letter C. Calcium carbonate. Or letter D. Ferrous sulfate. The correct answer, y'all, is letter A, lactulose, confusion, asterexis, and musty breath suggests hepatic encephalopathy from elevated ammonia. Lactulose helps reduce ammonia levels by promoting excretion through the stools. Question number 44. A nurse is teaching safety to a parent of a 9-month-old infant. Which instruction is most appropriate? A. Use a forward-facing car seat in the back seat. B. Place small snacks in the crib to encourage self-feeding. C. Keep medications in a high cabinet with safety locks. D. Allow the infant to sleep with soft pillows for comfort. Well, the correct answer is letter C. Kept medications in a high cabinet with safety locks. This is the rationale. A 9-month-old is mobile and explores by putting objects in the mouth. Poisoning prevention is a major safety priority. Medication should be locked away and kept out of reach. Next, a client with syndrome of inappropriate antidiuretic hormone secretion has a sodium level of 122. Which prescription would the nurse question? A. Fluid restriction. B. Seizure precautions. C. Strict INO. Or D. Hypotonic IV saline. Okay, the correct answer, y'all, is letter D. This is the one that we're gonna question. So SIADH causes water retention and delusional hyponatremia. Hypotonic fluids would worsen the low sodium level and increase the risk of cerebral edema and seizures. Next, a nurse is caring for a client with suspected C. diff infection. Which action is most appropriate? Letter A. Alcohol-based hand sanitizer after leaving the room. B. Place the client on a droplet precautions. C. Wear gloves and gown when entering the room. Or D. Keep the door closed with negative pressure ventilation. Hey, C. diff patient. Letter C is the correct answer. Wear gloves and gown when entering the room. Remember, C. diff requires contact precautions. Gloves and gown help prevent spread of spores. Hand washing with soap and water is prepared because alcohol does not really kill the spores. Next question. A newborn of a mother with poorly controlled diabetes is jittery and has a weak cry. Which action should the nurse take first? A. Assess the newborn's blood glucose level. B. Place the newborn under phototherapy. Letter C. Restrict feedings for 4 hours. Or letter D. Obtain a stool specimen. Okay, so the correct answer is letter A. Assess the newborn's blood glucose level, and this is rational. Infants born to a diabetic mothers are a high risk for hypoglycemia. This is usually after birth. Jitteriness and a weak cry can be signs of blood glucose level, so assessment is the first step. Our next question. A client with obsessive compulsive disorder is repeatedly washing their hands and is late for group therapy. Which response by the nurse is best? A. You need to stop washing your hands now. B. Your hands are already clean. C. Why do you feel the need to wash so often? Letter D. Let's set a time limit for washing so you can attend the group. Okay, correct answer is letter D. Let's set a time limit for washing so you can attend group. And this is rational. Compulsion should not be abruptly stopped because this can increase anxiety. Setting limits supports structure while helping the client gradually reduce ritualistic behavior. Our next question. A client is prescribed 750 milligrams of medication by mouth. The available tablets are 250 milligrams each. How many tablets should the nurse administer? A. 1 tablet. B. 2 tablets. C. 3 tablets. Or 4 tabs. Yay, 3 tablets is the correct answer. As you can see in terms of the calculation, if it's 250 per tablet and the order is 750, you need a total of 3 tablets. Our last question for this video. A client suddenly develops facial drooping, slurred speech, and weakness of the right arm. Which action should the nurse take first? A. Give the client oral fluids. B. Place the client in a supine position. C. Ask the client to walk across the room. D. Determine the time the symptoms begun. Okay, the last question and the last answer is letter D. Determine the time the onset or the symptoms begun, because this is what the rationale tells us. Stroke treatment depends heavily on when the symptoms started. Determining the last known well time helps decide whether a client may qualify for time-sensitive therapy. That's our last questions for our 50 NCLEX practice questions with rationale. Thank you for watching.